Good morning. I'm Dr. Steve Wengel. I'm a geriatric psychiatrist, as you probably heard, and I'm also the Assistant Vice Chancellor for Campus Wellness for UNMC. And in these two roles, I deal with a lot of folks that are very interested in wellness topics, and particularly, how do we find peace? These are stressful times, obviously, either because of personal issues you may be facing with your own health, with the world around us. Obviously, these are pretty turbulent times. So I'm going to talk about some practical tips and strategies that can help us all find a little bit of peace. So here's my agenda. We're going to talk a little bit about some of the physical and emotional tolls that stress takes on the human body, but mostly we're going to focus on these last two things. Let's talk about what we can do, and I put myself in the we, myself included, that we can all do for self-care activities that will improve our wellness, our physical and emotional health. And then I'll talk about some resources you might want to check out if you want to learn more. So I don't know if you ever feel this way, but I feel this way often these days. Sometimes we want that inner peace, but it's just like I don't have the patience to do it. I want it right now. So if you're like that, join the club. You're probably quite normal. One thing I wanted to talk about, though, is the context, right? So we're all living in the context of the pandemic right now. We're over 2 years into it, and it's still got lots of ups and downs, and has had ups and downs, and will continue to have for a while. But it impacts us, even if you're not thinking about it. It has changed the way we live, of course. But there are many, many other factors, of course, going on in the world today, which I don't have to remind you of. So there's that context on top of what each of us are going through individually with our own lives, and it all kind of works together. But one of the reasons I brought up the pandemic was that this is a topic that I've been talking a lot about in the last year, which I think you might find relevant. There's a term called languishing, which has been making the rounds a lot in about the last year. And languishing is a feeling of the blahs, feeling like you don't have a ton of energy, and maybe you're not super motivated to do the things you used to do, whether it's exercise or hobbies or things like that. And maybe you're kind of restless at the same time. So if you feel kind of restless and kind of not real motivated, kind of blah, guess what? You're probably normal, and you probably have a touch of what we call languishing. It is not depression, and it's not even burnout. It's something kind of different because of the background of all the stuff going on in our world, especially the long-term effects of the pandemic. So here's just another way of looking at it. So there's a nice article from the New York Times from April of last year, April 19th of 2021. So if you simply Google the word languishing, it'll take you to a couple of New York Times articles that you can learn more about this if you're interested. What do you do about it, though? Here's my prescription, Dr. Wengel's prescription for languishing. First of all, give yourself some grace, or another way to say that is cut yourself some slack, because you might be feeling guilty because you're not doing things that you normally would do. That's okay. Right now, I think we're just trying to get through it. So, don't feel bad. Don't feel guilty. Remind yourself, though, about meaning and purpose. What gives you the most joy in life? What gives you meaning and purpose? And sometimes that helps us get back on track, though. Connecting with others socially is always a good thing. Obviously, we want to do it safely with whatever rules may come down the pike about masks and social distancing and all that. But, connecting with others socially is always a good thing. But this last bullet point is probably one of the main ones I'd want to make in addition to the first one. So if you only remember two things, remember the first one, cut yourself some slack, and this last one, do a little something. So let's say you used to go to the gym and work out 3-4 times a week, and you haven't done it since the pandemic, and you'd like to get back into it, but you just don't quite have the energy to do it like you used to do it. You just don't have that much drive. That's okay. Maybe you say, I'm going to do it once a week, or maybe you don't even go to the gym, but you say, I'm going to get back to taking a walk, at least twice a week, even if it's only 5 or 10 minutes, I'm just going to get in the habit of taking a walk. That's what I mean by doing a little something. It doesn't have to be perfect. It doesn't have to be what you used to do. Just do a little something. And over time, it gets easier to do more. So there's one little tip. Now I'm going to shift gears and talk a little bit about neuroscience. So there's a part of the brain called the amygdala, which is kind of the threat assessment part of the brain. It's deep in the brain, and it's scanning the environment, looking for things that could hurt us. So it's very important for our survival. But nowadays, most of us don't have too many encounters with saber-toothed tigers or other kind of daily threatening things. But whenever your amygdala, I should say, perceives that there's a threat to your well-being, it's going to push the panic alarm or pull the fire alarm, and it's going to turn on the fight or flight system, which you've heard about. In medical terms, we call that the sympathetic nervous system, but either one, they're both the same thing, fight or flight system. And that in turn makes your body crank out a lot of stress hormones like, epinephrine, or which is also called adrenaline. That might be a more familiar term to you, adrenaline. But the other one is cortisol. And cortisol is a steroid hormone that is really important for our survival if you really are in a life-threatening situation like a car accident. It can keep you alive when you're in shock. But the problem is we have trained our brains and our bodies to crank out cortisol when we are not truly in a life-threatening situation. Like, for example, the pandemic. Yes, it's scary, and yes, people get sick. But just the fact that it's always lingering in the back of our minds, we're all producing more cortisol than we used to, which is probably why we're feeling some of the effects of, languishing. Here's just another way of looking at that same information. This is kind of an elaborate anatomy drawing, but we have these two halves of this part of the nervous system, the autonomic nervous system. So there's the fight or flight system, and there's the rest and digest system. So by default, though, we tend to spend a lot of time on the left side, on the sympathetic side, because of the fast pace in which we live, because of all the things going on in the world. Again, because of your own health, concerns and so forth. But the good news is there are things you and I can do to try to move things more to the green side, to the rest and digest system. So that's what we're going to mostly talk about here. But before I do, a couple other things. Here's some common reactions to stress. You might just feel kind of uneasy, even if you're not thinking about something or you don't have a specific worry. You might just feel kind of generally uneasy. You might be less patient with people, significant others, and friends. That's real common. You might have insomnia. That's been super common during the pandemic. They call it coronasomnia. It's real common. You might have physical symptoms, which might, again, if you're worried about your health, that could bring up fears that you're having a recurrence, for example, or something like that. And when you're really not. So, it is not unusual in times of great stress that our body will react by bringing out physical symptoms that maybe we used to have, or maybe we didn't have them in the past, but could be migraine headaches. It could be, stomach upset, could be a variety of aches and pains, muscle tension, you name it. But we all have something, and that's our body's way of telling us that we're under more stress than maybe we should be. So I think the main thing is when you're aware of that physical symptom cropping up, treat it as kind of like an early warning sign to do a little more stress management. Some of the things I'll talk about in a few minutes, whether it's exercise or meditation or things like that. Use that as a positive thing to say, well, maybe I just need to step up my routine just a little bit. Here's some things, though, that we kind of try. We do the do-it-yourself route, and sometimes we just deny that we're feeling anxious or stressed, and that in the short run, sometimes you have to do that just to get through the day, but in the long run, that isn't probably the best way. Sometimes we numb our pain through, alcohol and other drugs, or sometimes there are other distracting behaviors like spending too much time, internet searching or watching cable news or, you name it. I've been guilty of that. I would bet many of you have too. It's really, really common that we want to distract ourselves. And in some ways, it just makes things worse, especially if you're doing it instead of sleeping. It's probably not a good thing to do. So here's a cartoon, in case you can't read the caption. It says, wow, it's only 11 p.m. That still leaves time for me to ruin tomorrow by staying up doing nothing on the internet. Well, I've been there and done that. And I bet some of you have. So there's even a term for that. This term comes from China. This is the English translation: revenge bedtime procrastination. So you put off going to bed out of revenge for I don't know who or what, but you do that. Even though you would be better off sleeping, getting to bed, you still stay up doing stuff like that. So I do that. I watch old sitcoms to distract myself from the stress of the day and so forth. Again, common thing. Maybe not the healthiest thing in the world, but it's real common. There's another thing that we do to distract ourselves. So there's Alexander Graham Bell saying, now that I've invented it, I have this odd compulsion to hold it in my hand wherever I go and glance at it incessantly. So even he couldn't get off his smartphone. So do you have a smartphone? I got one right here in my pocket. I look at it all the time. We're kind of hooked on them, aren't we? We really just, when you're bored or anxious or whatever, oftentimes that's our default thing to do is pick out your phone and look at Twitter or look at the news or do something like that. And again, it's okay, but maybe we do it more than we should. I certainly have had times when I have. So let's now talk about the positives. Those are some of the negatives. Let's talk about the positives. Self-care 101. What can you do and what can I do? So first thing I always tell people is start with sleep, because sleep is so important to our health and well-being, as you well know, I'm sure. But oftentimes we don't get enough. And sometimes we don't get enough because we choose not to. We stay up late with that revenge bedtime procrastination. Sometimes we don't get enough sleep because we're trying to, but we just don't sleep very well. But anyway, most adults need between 7 and 9 hours a day. 7's a good minimum. If you don't get enough over a period of time, it can make you feel down, it can make you feel anxious, and it can even kind of cause some memory problems that will get better, hopefully, when you start sleeping better. One of the reasons why sleep is so important is that's when our brain takes out the trash. And again, I won't bore you with all the science on this, but the researchers have found that like mice in the laboratory, when they're sleeping, they open up channels in their brain where they get rid of toxic substances that accumulate during the day. And it only happens when they're sleeping. So that is when our brain purges itself from toxins that accumulate. So that's probably true for humans too. So that's one of the reasons why sleep is really important. Incidentally, if you're having trouble sleeping, let's say it's not bedtime procrastination. Let's say you're trying to sleep, but it just isn't working. I'll give you some tips here at the end. The other thing I like to recommend, though, and again, this is not going to be news to you, but exercise is good for you. Hey, headline news, exercise is good for you. Well, you know that, of course, right? So some people say, in fact, a neuroscientist once says, exercise is like Miracle-Gro for the brain. In this time of year, springtime, with doing our gardening and getting out the Miracle-Gro, well, you know what Miracle-Gro is. It's really, exercise is like that for the brain. It really makes brain cells stronger and healthier and happier. Can reduce anxiety, improve mood, and even helps you think better and solve problems better. It gives you perspective, because sometimes when we get stressed out, we lose perspective, right? We think the sky is falling when it really isn't. So I really encourage you, if you're not already doing some exercise, do it. And even if it's, like I said earlier, a little bit, 5-10 minutes of walking to start, just something. And it will build on itself. I mentioned perspective taking. This is a sentence that you can say to yourself, and I personally say to myself on a regular basis. I learned this from an article in Psychology Today, written by a PhD psychologist, saying, sometimes I just feel really stressed and uncertain and kind of unsettled. And so sometimes I force myself, take a couple of deep breaths and say this phrase, I'm all right now, and put the pause in, I'm all right now. Take a quick scan of your body. Are you hurting anywhere? Are you hungry? Are you cold? Are you too warm? And if you can say, really, in general, I'm actually pretty comfortable and I don't really have a big threat to my existence right this moment. I don't know about tomorrow. I don't know about next week. But for right now, I don't have any threats to my existence. So I don't need to turn my amygdala on. So then you just say to yourself calmly, I'm all right now. Try that. And you might find that pretty helpful. Spending time in nature. It's a great time of year. Of course, sometimes we get rain that, when I'm recording this, we just got through a rainy spell, but, but spring is a great time to get outside. Japanese researchers actually call this forest bathing. Getting outside in nature, like a forest setting, can actually reduce your heart rate or your blood pressure and increase your heart rate variability, which is a good thing. And it really is good for your health. You don't have to, and you can see here that they would research people spending 2 to 4 hours in a forest. You don't have to do that. That's obviously a lot of time and commitment. But doing anything where you're out in green space, taking a walk, in any kind of green space is really good. It doesn't have to be a forest. They found people that walk along, even like manicured lawns or other green space tend to be less stressed than people that walk like in a downtown area where it's all concrete. So I really encourage you to get outside. There's a study, if you want data, that says that they studied 20,000 people in Great Britain, and they found that if people that spend at least 2 hours a week outside or more were healthier, physically healthier and emotionally healthier. So 2 hours a week, that's about 15 or 17 minutes a day if you want to do the math. So I think it's just really good. Even if you're not exercise is good. So if you exercise outside, you get, hey, guess what? You get 2 for the price of 1. But even if you're just spending time outside, you're having your morning cup of coffee outside on the deck. That's a good thing for your mind and your body. The other thing I like to do is build in micro practices. So what do I mean by a micro practice? This is something you can do in about a minute. So here's an example. I encourage you to do this right now after I tell you how to do it. So if you breathe really slowly for a little while, that will tend to turn on that rest and digest system we talked about earlier. Here's a good way to do it. Count to 6, just silently, not out loud, but count to 6 inside your head as you take a breath in. Hold it for maybe a couple of seconds. And then count to 6 as you exhale. That's all there is. But it is hard. It takes a little practice to do it that slowly. But breathe in, breathe out, 6 seconds in, 6 seconds out. Do that for a total of 4, count them 4 breaths, and you will find you will be a little bit calmer. Sprinkle that in 2 or 3 times throughout the day, and you will find it really helps. The more you practice it, the better you get at it. I also like to use the humanities. This picture, which you may not be able to see because it's kind of small, is a new choir that we started for healthcare professionals here at UNMC in Nebraska Medicine. We have many talented people here, doctors, nurses, students, and others, and techs and administrative folks. Anybody can join. So we have a choir that meets and gets together and sings together. They just had a concert in May. We also have a medical orchestra that anybody in healthcare can join. So I think the humanities are a really good thing. They reduce burnout. Taking part. You don't have to join an orchestra or choir. Just listening to going to concerts, listening to music that you enjoy, reading a book, especially poetry or fiction. Anything like that, the humanities, that anything that involves the arts is really a good thing for your mind. And I really, really encourage you to think about maybe that might be a fun thing to start. Learn a new type of music to listen to. Maybe get into jazz or get into classical music if you're not already, or get into reading some poetry or something like that. Pick something in the arts. You might find that, really enjoyable, but also good for your stress. I like the idea too of keeping a gratitude journal. The scientists have found that if you do this, if like once a week you write down 3 things you're grateful for that happened in the last week, you will tend to be more positive and more content. So I personally do this. So every Sunday I get out my journal and I write down 3 things I'm grateful for that happened the last week. And I try to come up with 3 new things every time. So that's what makes it hard. You can't just say, didn't get COVID. If you said that a couple of weeks ago, you want to try to come up with something new each time. But can be really, really helpful. Consider mindfulness and meditation. I'm a big believer in this. I do 10 or 20 minutes of meditation most nights before I go to bed. And I'll give you a resource of how to learn to do that if you're interested. Here's a TED Talk also that I think is really good. If you just simply Google this person's name, Sarah Lazar. She's a scientist at Harvard, real smart person. And TED Talk, you'll have an 8.5 minute long TED Talk on why meditation is good for the brain. So if you want to learn more about the science of it, listen to my colleague, Sarah Lazar. This is one of the studies she did, which I don't have a lot of time to go through, but let me just say she found, and if you hear her TED Talk, she'll go into more detail about how she found that meditators actually seem to have, thicker, stronger brains as they age. So it seems to reduce some of the normal shrinkage we get as we age. Here's a way to do that meditation. So this is kind of like the breathing thing we did before, but this one goes on for about 10 minutes. And so in this case, you simply, as you take a breath in, it doesn't have to be as long as we did before, just take a little longer than normal breath. And as you let it out, say the word 1 silently inside your head and make it as long as the breath. So I'm going to take a breath in and then I'm going to say 1 real long. Again, not out loud, just inside my head as I exhale. And that's it. Do that for about 10 minutes. Don't set a timer. Just look at the time on your phone and then, do it for about 10 minutes. And you'll find if you do that, it takes about 2 weeks of practice, but after you get the knack, it's really, really good. And it really tends to make you feel a lot calmer for about the next day or so. It actually lasts about a day. Some other resources I promised. So there's 3 free apps that I really think are great. These are put out by the Veterans Administration, so they're free. Nobody's trying to sell you anything. So COVID Coach is my personal favorite. It has a lot of mood check. It's got a mood checker and an anxiety checker, so you can do a little checkup on yourself. It's got a whole bunch of really helpful stress management tools. If you're struggling with insomnia specifically, get Insomnia Coach, which again also put out by the VA. It's really helpful and will teach you how to make your sleep better. And then lastly, if you want to focus specifically on mindfulness things and meditation, get Mindfulness Coach. Again, COVID Coach has some of all of that in it, so that's a good place to start. So in summary, uncertain times like this can make us feel more anxious. That is normal, whether it's uncertainty about your health, whether it's uncertainty about the future of the world. There's just a lot of reasons. And it's always been uncertain, right? Life has always been full of uncertainty. So uncertainty makes us feel more anxious. That's normal. One thing I recommend to people, though, is put a name on it. Name it to tame it, as one of my psychologists used to say. Gee, I'm feeling more anxious today, or maybe I've got a little touch of languishing today, whatever. Put a name on it. Can actually help. You'd think that would make you feel worse, but it actually tends to make you feel a little bit better. Connect with others, I mentioned before. Watch your sleep. Get some exercise and spend some time outdoors. And consider mindfulness and meditation. I know this can seem like a long list. Don't try to do it all. Just pick one or two things and do it for a while, and then you can add to the list later. And now I am going to stop talking, at least stop talking in a one-way fashion, and I will look forward to answering questions. Thank you so much for your attention today.